Thanks for staying with us at STL Live. I'm Sarah Bernard, and we're learning about the City of St. Louis Department of Health with registered nurse Shanese Bolden and MPH epidemiologist Yvette Ineza. So welcome back, Yvette and Shanese. So glad you guys are both here. So in the last segment, we were talking about, Yvette, your role of studying disease and how it affects the City of St. Louis, and Shanese, your role in helping the community learn prevention. And right now we're entering the flu season. We're just at the beginning of October, barely into fall, but you've already started to see flu cases, is that correct?
Yes, we've gotten a few flu cases in since flu season has started. So hopefully people will go out, get vaccinated, and use preventive measures in order to not get sick. So that way St. Louis won't have many cases this season.
So what are the primary reasons that people give for not wanting to get a flu shot?
I think that most people are just scared of getting shots. If you can recall as a child, that wasn't your most favorite thing to do, and for a lot of adults, it's not their most favorite thing either. But it's quick and easy, one little prick and you're done.
And so much better than being sick for a week.
Yes,
and
yes.
The flu, there's nothing worse than the real actual flu.
Yes, there are a lot of symptoms that go with it that no one wants to bear. Headache, sore throat, runny nose, chills, fever. Some people get diarrhea, vomiting. So there are a lot of symptoms that go along with the flu that aren't very pleasant. So the vaccine is definitely more preferable.
Yeah, and when would you suggest that somebody actually go to the doctor? Because the reason we know there are cases out there is people have actually gone in and been tested. So at what point does it make sense, whether you've had the flu shot or not, to go in and get medical care?
So the minute that you realize that you may be sick, it doesn't hurt to follow up with a physician or a doctor, especially if you have a fever. So if you have a fever or you feeling flu-like symptoms, which is sore throat, runny nose, coughing, sneezing, headache, chills, body ache, fatigue. Like I said, some people may get nausea, vomiting, diarrhea. These are all signs and symptoms that you need to see a physician and follow up, and that you need to stay at home, because at this point you could actually spread the flu virus to others, and that's definitely not good. Once you follow up with your physician, if you are prescribed flu antivirals, you need to take them as prescribed.
Yeah, and Yvette, in your role, do you see certain members of our population who are more at risk than others when they get the flu?
Most of the time we know that children or elderly or people who have other health outcomes, they are more likely to get the infection because the immune system is already weak.
Yeah. So the very young and the older people in our community especially need to be getting those flu shots. And can babies get the flu shot? I mean, that's what is the minimum, the youngest?
So at least 6 months of age is recommended for getting the flu shot.
And there's no upper limit in terms of any risk associated with the elderly getting the flu shot?
No, and actually there's different strains of the flu vaccine just for the elderly because their immune systems are weakened.
Oh, really? Mm-hmm. Is that right? Okay. So, Yvette, now we're early in the season, I realize, but are there any signs that tell us that this year is going to be particularly bad for the flu?
Well, it's too early to say anything, to have those numbers, so we're keeping our eyes open and looking at those numbers, and we're going to start putting our report up on our website, and we'll be sending prevention method on our website as well. So it's so early to predict how the flu season this is gonna be, because we do know that every year is different, but that doesn't mean say people need to go out there and just start getting prevention going, get flu shot, wash their hands, see medical care if needed as they have the symptom just mentioned.
Yeah. If you think you've been exposed to the flu, is there anything that you can do to prevent it coming on?
If you think you've been exposed, then your best bet is to follow up with your physician to make sure that if you were exposed and you do have the flu, that you get the flu antivirals that you need.
So you can get that right away?
Right.
Okay, even before the onset of symptoms?
Yes.
Okay. Is there anything else before we go to break that you want to make sure that our St. Louis viewers know?
If you're sick, please stay at home.
Okay. There you go. You heard it from the nurse's mouth.
That's right.
Please stay at home if you don't feel well. And the City of St. Louis Department of Health strives to maintain healthy communities by providing protection, promotion, and prevention for the public's health through their various services. For more information, call 314-612-5100 or visit stlouis-mo.gov. And there's more STL Live after this. Stay with us.